My name is Dr. Timothy Hain. I'm a neurologist here at Northwestern Memorial Hospital, and I'm also a professor of otolaryngology and a professor of physical therapy, human movement sciences. The diseases that I most commonly treat are causes of dizziness and hearing problems. And so, for example, I very frequently see patients with BPPV, or benign paroxysmal positional vertigo, because this is a very common cause of dizziness. I frequently see patients with Meniere's disease, with migraine-associated vertigo, or with just have symptom-related problems such as hearing loss or tinnitus. I take, I would call it a tertiary care approach, and so usually patients who come to see me have already seen 2 or 3 other doctors who have failed to satisfactorily answer the question that the patients have. And so we take a very thorough approach to patients. We do a interview and physical examination, and often we end up doing some fairly sophisticated testing of their ears or sometimes of their brain in order to do the best job we can to understand what's wrong with a patient. Typically a patient who comes to see me, they not only often see me, but they may see one of my audiologists who help with the testing, or they often see some physical therapists that work with me also. And so we realize that sometimes not everything can be fixed with medication. Sometimes there are better ways to approach it, such as using rehabilitation techniques. I am very much like patients who are actively participating in their care. And so I'm very happy when patients come in and say, well, I've been looking this up on the internet and I'm wondering if I have this or I have that. And sometimes they're right on the mark, and sometimes I say, well, that's not quite what I think you have. But I'm very happy with patients that are actively involved in their care, and I try to help them, and sometimes they help me.